Medical care has become too complex, too uncoordinated, and there has to be somebody that's able to integrate primary care, specialty care, inpatient care, and outpatient care. And that person is the primary care physician.
I met Dr. Murphy about 35 years ago. I don't remember my particular ailment when I went to see him, but obviously he got it fixed, whatever it was. He's taken care of me, my wife, and my 5 children, and their children for the last 35 years.
Mr. Stanley's had a known medical problem that we've been following for a number of years. He's been aware of it, I've been aware of it, and over the past number of years, probably 5 years or so, it's been necessary to develop a relationship with a cardiologist. That would be Dr. David McPherson. We were able to monitor this ongoing problem, which reached a point within the past 2 years where there needed to be an intervention.
Collaboration is very important when we're talking about the overall health of any of our patients. Thorough communication has to occur. Along that whole spectrum of care, each and every component must communicate with the other so that the patient can have a good outcome.
A year ago, I had a triple bypass and a heart valve replacement. And it became a joint venture between Dr. Murphy and Dr. McPherson. And they communicated together in front of me all through the ordeal.
We cannot forget that a good primary care physician is willing to sit down and talk with someone about their problems.
It was well established what was going to happen, who was going to do it, and there were really no surprises.
We replaced his malfunctioning valve and put a brand new valve in, such that both his heart could work better and he could feel better.
One day, all of a sudden, I just realized I feel normal. And up until that time, I did not feel normal.
What I do as a heart surgeon is very important, and we'll take care of the immediate problem that needs attention. But that chronic, that long-term success really relies on good medical management by a good primary care physician.
Developing a roadmap over time. What should I do as far as prevention goes into the next 1, 2, and 5 years?
Making sure they have routine follow-up, making sure that the medications are maintained. All these things are very important in the recovery.
But there was always the undercurrent that Mr. Stanley had a long-term view of where I wanted to be at age 75, 80, 85. How do I get there? What do I need to do?
Oh, I think I think you have to have a primary care physician. You can either that or you're going to be your own doctor, and you're not going to be very good at it.
If you wake up in the morning and you have a headache, it doesn't necessarily mean you have a brain tumor. It probably means you simply have a headache. You don't need to see a neurologist or a neurosurgeon or the like. You need to see a primary care physician who can diagnose you, evaluate, and provide a treatment plan that, well, by the way, this is simply a headache.
I walk 3 miles a day. I work. I do anything I want to do. There's no restrictions in my life anymore.
We as physicians at UT Health feel privileged to care for patients. This is why we go into medicine. And I think that's real important that this comes across to the patient.